I am from Portland, Oregon, and I don't know if you've ever had a voodoo donut, but if you haven't and you want one and you're in the city of Portland, you're going to have to wait in a line that generally stretches all the way around the block. Because why in the world couldn't you love a place that served maple bars with crispy bacon on top? Now I bring the donuts up because when I started out, my marketing strategy centered around taking donuts to discharge planners. In the late 80s and the early 90s, that's how we marketed. We went to the hospital, we gave them donuts, maybe cookies, and we built a little relationship, and magically, we got referrals, right? Clearly that does not work in our environment today. The real risk to us as post-acute care providers is what we call the narrowing of the networks. Hospitals and hospital health systems saying, you know what, we're not just going to discharge to all those facilities just because they bring us donuts. And so if you're one of those facilities that is remaining as a contractor with that hospital or referral source, you're pretty happy, right? But if you're one of the 6 that didn't get into that network, you're scared, and you potentially are going to have some real challenges. And what I think will ultimately play out is that while the hospitals and the health systems are very important to us, what's more important in the future is going to be the managed care payers. They go to that hospital and they say, look, we'll have a case manager here that's going to manage those discharges and coordinate them and make sure they go to these 4 facilities. The hospital's not going to have control at that point. And it is a scary reality, and it's one that we've seen playing out in our world. I believe over the next 5 years, it's going to be a very challenging time. And I think there are going to be losers. Go back to 1998. We lost publicly traded companies and ancillary businesses. They went bankrupt because they couldn't adjust their costs to the new payment model. Now, before we get too depressed, I also want to say I believe there will also be winners. And I think that the good news is if you're a winner in the next 5 years, you're going to be a winner likely for another 15 years until that next transformative change happens in the marketplace. The fundamental change that we're all dealing with is that we are now being judged by our performance. We're going to be paid by performance, and we're going to be contracted with by performance. And so out of this, I really wanted to highlight 5 areas that I believe will be the primary areas around pay for performance. So the first one is hospital readmissions. It's imperative that you now know what your hospital readmissions are, not only for your facility or facilities, but how you compare to the other facilities in your area. The next one is length of stay. And I will tell you that I believe that the pressure that we will feel in our future is going to be how do we lower the lengths of stay. Functional outcomes. It's not going to be a pay-for-performance area today, but I'm going to tell you in the next 2 or 3 years, I think you will have a withhold, just like readmissions, based on how you're doing in terms of functional improvement in your facilities. Quality measures. Now, almost everyone in this room could probably come up on the stage and make the argument of why the 5-star system should not necessarily drive how a provider is either narrowed out a network, and it's certainly not worth a 30% reduction in our RUGs rate, right? It is not a hard argument to make, and yet we're seeing this in managed care rich environments. We have to be able to manage it. Customer satisfaction or customer experience is the last pay for performance area that we think is going to be significant, although I will also tell you that I think it may be the last to be introduced. Clearly, we cannot expect other people to define our value for us. And not only that, we can't trust them. If you think you're going to trust a managed care payer to demonstrate your value so that they can pay you more, it's not going to happen. If I want to make my argument, if I want to pitch my value, a lot of the information that I need is sitting within PCC. Your decision to be with PCC has positioned you guys to be able to be a winner today. So we started thinking about it, and we started to learn some other principles that were going to become very important to us. One is the data had to come out of a mandatory workflow. It had to be timely. Today, it's every hour. And the third thing is that we realized that we were going to have to get data from other sources. While we could get the majority of them from PCC, there was other environments that we were going to have to go to. There are three imperatives. As a provider, we need to know our data. We need to be able to use our data to improve our results. And we got to leverage it into market share. What we're really saying is you've got to be able to compare your facility's results to your competition. You've got to get better results, and you've got to be able to demonstrate those results to your payers and your referral sources. Donuts will not work anymore. These are the things that you've got to do.